I'd really want to address the food handlers or these people who operate in food establishments, especially during this pandemic, the cholera epidemic. We really need to put up measures as key stakeholders during this time. And it is very important to look at the measures we need to take in order to prevent this. When we walk around into these food establishments, because we do the inspections, we find most of them are not abiding to the measures. Among the measures, you will find those small vibandas and kiosks that have been set up everywhere in our small towns. I know there is the aspect of trying to support our local people, but remember that if we eat food that is contaminated, then it will injure our health. So I'd love to call out for those people who have those food establishments. First and foremost, we need to ensure that we have enough supply of water. This enough supply of water will ensure that whatever we are cooking, we are washing very thoroughly. The people who are coming to the premises, they are washing their hands thoroughly before they eat. We also have the food employees, the staff who are employed there. They need also to be washing their hands very well before even they prepare these meals. I know when you walk to these people, most of them do not have the medical certificates. They rarely come to do for medical examinations. And we know that most of them might be carriers of harmful germs or bacteria which can result to these diseases. So I call upon to you, especially these critical times, can you make sure that all the food personnel in those establishments are medically examined? I'd also like to say that those people who do not have the sanitary facilities, then I think it is a high time you close shop or you get to a place where you know that your people can be able to relieve themselves. Then for those who have them, it is important also to maintain them clean.
Because this training is coming at the right time where we have had increased number of cases of diarrhea and as well as an outbreak of cholera that is happening in our neighboring counties as well as our county. In the last 3 weeks, about 3 weeks ago, we were affected by a cholera outbreak that happened in Kiambu County, whereby some of our residents here had gone for that wedding, and when they came back, they developed signs and symptoms for cholera, and we are taken to hospital and we are confirmed to be cases of cholera. 3 of them were confirmed and we are treated in various hospitals in Kiambu and Nairobi. So far, all of them have recovered and been discharged, but and follow-up of their contacts has also happened. We were able to identify all the contacts. We have screened them, give them health education, given them prophylaxis, and we are sure that we will not get more cases from that initial outbreak. However, yesterday we received a report from Kandala sub-county, that is Idhiru ward, Githoya village, whereby 2 residents and developed signs and symptoms of cholera, and we are rushed to the nearby health facility, that is Vika Level 5 hospital, where they were tested for cholera, and initial reports indicated that it was positive for cholera.
For the purpose of training public health officers on CLTS, which means community-led total sanitation, which simply means we are giving the powers to the community to ensure their neighbors have proper sanitation for purposes of preventing diseases. Our training here today is funded by World Bank through THS, and the topics being covered are the same. This group will then move out. They'll go and hold meetings at the community level. We call it triggering. They'll trigger the community to realize they have been eating their own feces, and community will construct toilets. And we are not saying you put up a very good toilet. Tunasema bora show. That's what we say in CLTS. The moment they do that, and what is interesting, as we started our training here, we have had reported cases of cholera outbreak. Cholera is simply a hygiene disease. And as I was saying, on 14th of October 2022, we had a celebration of Global Hand Washing Day, which was witnessed all over. We know that hygiene can stop and prevent spread of diseases, as the case was with COVID-19. Sadly, and this one I repeat, there has been negligence of preventive and promotive medicine. And I am requesting the government, the county government and the national government, to give emphasis on prevention, not curative. We can't forget curative. And we have a classic example where people are coming for dialysis, so we invest in dialysis machines. Instead, we should go to the field and educate people on nutrition so that we avoid people having renal failure. Prevention saves money. It saves time, because if somebody doesn't get diarrhea, the man hours used to go to hospital. That person will be doing something productive. There has been a rumor from yesterday that we are going to close down eateries. That is not the mode of operation. The cases we have are all imported, as you have been explained by the disease surveillance officer. We know our first cases came from Limuru. We have addressed them. The cases now in Kadara, they came from Nairobi, and we have arrested that. So we have no fear, but we are in full gear. We have the equipments. We are equipped to ensure we sample the waters and to educate people. I would ask the public, Hasa, those ones in urban centers where there is a lot of hawking, to exercise maximum care. Simply wash your hand, identify the source where food is prepared, ensure when you go home the toilets are used. Wash your hands with soap. And this is what we talked, if you remember what we talked on 14th. So we are saying if we can be resourced, we can be given resources. And preventive medicine takes ground. This country will save a lot of money, and let's invest in preventive and promotive medicine.